Hello, public health students. I hope you're enjoying this class on motivational interviewing. I know it's a lot of new material and we're sort of presenting it in rapid fire. And this is week 3. We're talking about conversations about change. How do we go about talking to people about change? So we're going to be covering therapeutic styles, which I'm going to be asking you to think about how various clinicians have spoken to you as you've gone to get health care and how it feels to be spoken to in certain ways. Talking about people's ambivalence and motivation and how clinicians automatically want to try to fix everybody. That's kind of why we went into medicine in the first place. But that doesn't really help people all that much. And then we'll review and check out. So we're going to explore 3 interpersonal communication styles, and you'll practice using them, I hope, in your life and thinking about them. You'll explore motivation and the nature of ambivalence, and we'll discuss the writing reflex and discuss its causes. What are the 3 interpersonal communication styles that we use clinically? And we can also call this a discussion of the spirit of motivational interviewing, or the stance that we take when we're sitting with clients. So let's talk about our client Sam, a 30-year-old diagnosed with bipolar disorder. He uses cannabis and he chooses to smoke marijuana instead of taking his medication. Sometimes his choices lead him to strike out at his mother with whom he lives. And Sam's stated goal is he wants to have a relationship with a woman. He wants to have a good relationship. There are 3 interpersonal styles we could use with Sam. The first, those 3 styles are directing Sam, number 1, number 2, guiding Sam, and number 3, following Sam. So we're going to talk about the 3 styles of directing, guiding, and following. If we're going to direct Sam, we would be telling him, advising him, ordering, and we would be leading him, sort of like this fellow trying to pull his dog along on a walk. So if we're going to respond to Sam with a directing style, Sam wants a girlfriend, but the clinician has been told by their supervisor that we need to get him to adhere to his medication. And so Sam says, "You said we could work on my goals, and I want a girlfriend." And you might direct him by saying what? So think to yourself, what would a directive person say to Sam? Okay, so the next style is the following style, which means allowing, permitting, observing, and going along with. Okay, so how are we going to respond to Sam with the following style? Sam wants a girlfriend, but you've been told by your supervisor that his priority needs to be to get him to adhere to his medication. And Sam says, "You said we could work on my goals. I want a girlfriend." And so you follow him by saying, "Yeah, Sam, tell me who your ideal woman is. What are you looking for in a girlfriend? And let's talk about where you could find that person." That's following. Okay, so our next job is to talk about a guiding style. So guiding style is kind of in the middle between directing and following. It means working with someone, collaborating, trying to evoke motivation from them, which means drawing out their motivation, and while also honoring their autonomy. So we're going to guide Sam by saying, Okay, Sam, that sounds great. Why don't we talk about what you're looking for in a girlfriend and maybe what it would take for you to find your girlfriend, but also, with your permission, I'd also like to talk about how it's going with your medication this week. So that's a guiding style. All right, so in general, we're going to use all three of these styles according to what the needs of our client is. So our go-to style should be the guiding style, and the guiding style corresponds to MI Spirit if you've been doing the reading. But there are times when we're working with people that we're going to need to direct or follow. So directing style is appropriate for an emergency or crisis situation, and also right after trauma, people with severe depression or who are shut down or they're ill, they need a more directive style. A following style is appropriate for clients who are already really working on how they're changing. And so we can just go along with them in their journey and guide and follow them and to some extent guide them. And the other time we adopt a following is if a client's being extremely difficult and resisting, then we'll follow and validate for a while, hoping to build a better alliance. Okay, so let's talk then about motivation and ambivalence. We've started talking about this already, but we're going to really give you the meat of it today. Why should we be interested in patients' motivation for behavior change? So there are models that we all have in our heads about what makes people change, and probably the model you have in your head came from your mother and father. And different ethnic groups have different models. And in terms of clinicians, we have a traditional approach and we have the motivational interviewing approach. So most people, or a lot of people, got the stick model or the traditional model from their parents, who change is motivated by discomfort. So if I yell at you and make you feel really uncomfortable, then that'll make you feel bad. And if you feel bad enough, you'll want me off your back and you'll want to change. And going along with that philosophy is the idea that people have to hit rock bottom in order to be ready for change. And then the ultimate source of that is people don't change if they haven't suffered enough. So maybe it's the clinician's role to make them suffer. And then if they suffer, they'll want to change. That's their traditional approach. And that's really, in the 70s, that's the way clinicians used to treat people. And often people, a lot of clinicians, especially clinicians over my age, older clinicians tend to treat clients like this or patients like this because that's what they learned. So it says, you better or else. If the stick is big enough, there's no need for a carrot. So another corollary of this approach is someone who continued to use is in denial. So the best way to break through is directly confront them. Don't you know you're an addict? Don't you know you're eating too much and you're going to get fat and you're going to get type 2 diabetes? And we'll confront them and that'll make them change. So at this point, if you could please, I'm going to stop here and I'm going to send you to Canvas to the video on the ineffective consultation. And it's the video on this slide. And then when you're done watching that, you can return to part B of this presentation. Thank you.